Feeling cold in your hands and feet is a common complaint in people with adrenal fatigue. This is Dr. Lam, founder of drlam.com. In this video, we will talk about the reasons why people can feel cold. Now, one of the most common reasons that the temperature of the body lowers, which leads to cold hand and feet when everybody else is warm, is the low thyroid function. Now, remember, thyroid is the organ that controls the basic metabolism of the body. So if thyroid, the function goes down or slow, then the body will feel colder than normal. And this is very common and it's a classic sign of hypothyroidism along with dry skin and fatigue. Now, you can also get cold hands and feet from other problems as well, including some autoimmune conditions as well as some other type of situations. Now, if you do feel that you have cold hands and feet when everybody is normal and it's beyond what you feel is normal occurrence, then you should see your doctor to get it checked out. Now, if your thyroid is normal, or if you're on already thyroid medication but you still feel cold hand and feet, then you have to ask is why. One of the reasons is because your body's ability to take in thyroid may be compromised. Number two, the thyroid dosage may not be sufficient. Number three, you have things that's blocking the entry of thyroid replacement into your cells, causing the body to not get the metabolic stepped up that it's supposed to be. Now, there's also another situation which can cause cold hand and feet, is that when your thyroid is perfectly normal, but you have symptoms of hypothyroidism. And the symptoms of hypothyroidism include, as we said earlier, cold hands and feet, because the body is being driven to slow down under the control of adrenal glands. In other words, if you're in adrenal fatigue, the body tries to slow down. And when the thyroid slows down, then you're going to have symptoms of subclinical hypothyroidism. In other words, you may not be hypothyroid in laboratory tests, but symptoms-wise, you feel like you're hypothyroid, and cold hands and feet is one of them. So if you do feel that you have cold hands and feet, your thyroid test is normal, and your doctor say nothing's wrong with you, then you have to think whether adrenal fatigue is part of the reasons or not. Are you under a lot of stress? Are you under a lot of extraneous pressure at work or at home, or relationship issues that you cannot deal with? Do you have this problem for a long time? Do you have hormonal imbalances in your menstrual cycle if you're a woman? Do you have libido that is low in both sexes? These are all signs that you also look for along with a low body temperature as well as cold hand and feet. In fact, one of the very interesting things is that if you have a low thyroid function because of adrenal-driven events, then even if you put in thyroid medication as meaning replacement, like T4, T3, or combination, you will continue to feel cold because the body continues to slow down despite your best effort. So if you feel cold in your hands and feet for no apparent reason, if this continues despite thyroid replacement, if there are no other possible structural issues that can cause this problem, then do think of adrenal fatigue as a possible symptom etiology. I hope you've enjoyed this video. For more information on this topic, head over to drlam.com, where I have written over 1,000 articles to help educate people. You can also call me at 626-571-1234 for more information on adrenal fatigue and how to navigate it. Finally, if you enjoyed this video, please subscribe to my YouTube channel. Thanks for watching.